Okay, everyone. Unfortunately, my screen has a glare, so we're gonna try to do this like this. We're gonna see if we can work this out. But more right to health care is what we're talking about today. I'm gonna start by saying, okay, more right to health care. Health and basic care should be a necessity, necessary preconditions for the exercise of most other fundamental rights. Healthcare needs are among the most basic of human needs. It's difficult to think of competing interests that are more pressing or more significant than our interest in basic health care. So we're starting just really to talk about what makes it important to consider more rights in healthcare. And I'm gonna give a couple examples of things that we can do in the hospital to make it better to ensure that we're considering all our patients more rights, as well as giving the best care possible. More rights to healthcare. UN Declaration of Human Rights expressly includes a human right to adequate medical care in Article 25, which states everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or lack of livelihood in circumstances beyond his control. This pretty much says that we're in the field of making sure our patients are healthy, and due to the Affordable Care Act, which has been established recently, a lot of the gray areas for people who were uninsured are not as much as a problem as they were in the past, as it was in the past. It's hard trying to hold this thing and do this. Okay. First thing I'm going to talk about is code of ethics, which includes autonomy, benefits, non-maleficence, justice, respect for persons, and truthfulness and honesty. By practicing the code of ethics, the code of ethics really is based upon practicing the profession with honesty, integrity, and accountability, respecting all laws and avoiding involvement in any false, fraudulent, or deceptive activity, promoting the right of privacy for all individuals, and protecting the maintenance of confidential information to the fullest extent permitted by law. We also have to focus on cultural competence. Cultural competence is considered as a set of conduit behaviors, attitudes, and policies that come together in a system, agency, or among professionals, and that enables them to work effectively in cross-cultural situations. Essential elements that enable organizations to become culturally competent include valuing diversity, having the capacity for cultural self-assessment, being conscious of the dynamic inherent when cultures interact, having institutionalized cultural knowledge, and having developed adaptations to service delivery reflecting understanding of cultural diversity. Other areas of cultural competence, which by being in America, we have to be prepared to deal with a diverse number of patients. But here are a few challenges that us in the healthcare industry usually face. Social cultural barriers, poor cross-cultural communication, language barriers, attitudes toward healthcare, beliefs in diagnosis and treatment, lack of cultural competence in the design of the system. All these things can potentially not have us, can keep us from being at the level of cultural competency that we should be at. So we have to watch for these areas to make sure that we're fair to our patients, and we show, even though they might be diverse in us, that we're here to help them if they allow us to. Okay, now this is probably the most important of the three for us anyway, which is medical malpractice. Well, for the professionals and for the hospital in general. Medical malpractice occurs when a hospital, doctor, or other healthcare professional, through a negligent act or omission, causes an injury to a patient. The negligence might be the result of errors in diagnosis, treatment, aftercare, or health management. Medical malpractice can occur from a violation of standard of care. An injury was caused by the negligence and an injury resulting in significant damages. Here are some examples of medical negligence that might lead to a medical malpractice lawsuit. Failure to diagnose or misdiagnosis, misreading or ignoring laboratory results, unnecessary surgery, surgical errors or wrong site surgery, improper medication or dosage, poor follow-up or aftercare, premature discharge, disregarding or not taking appropriate patient history, failure to order proper testing, and failure to recognize symptoms. So we're sure that we want to look at all these areas to potentially avoid any type of malpractice lawsuits or frivolous lawsuits that may come by something that's on our part that we could have done better. So really much in conclusion, moral rights are very important to each and every individual. Now I say by following a code of ethics, making sure that we understand cultural competency to the best of our ability, that will lead to avoiding medical malpractice lawsuits of any kind on a level of morality and just mishaps on our part. So thank you for your time, and sorry about the screen. All right.